Yeah, so I think we should just do a bonus question. Let's add question 29 to this. We have a 52-year-old man with diabetes, hypertension, and hyperlipidemia who presents with severe painless visual blurring and cloudiness in the left eye, which he woke up with this morning. So it is sudden. The fundoscopic examination findings on the left eye are shown in figure 1.4. What diagnosis do you suspect? So these are fundoscopic examination. The question is, what do we see? So we can see some optic disc edema, and we can see some sphincter hemorrhages. If you take a close look, you can see a complex disc. It's kind of crowded. So let's try to look at our options. We have A, acute optic neuritis. Now, this is very unlikely. Why? Look at the question stem. Optic neuritis usually affects people between the ages of 20 to 30, generally females. Yeah, so this person does not really fit the demographics, and these symptoms are not looking like that of optic neuritis. They did not talk about the RAPD, which is actually a classic way to identify optic neuritis. So let's try that out. Giant cell arthritis usually comes as a form of headache, with worsening of pain on chewing. So claudication actually worsens the pain. Yeah, this is now giving us a picture of giant cell arthritis. Although it should be noted that giant cell arthritis can actually cause blindness. Yeah, but then the fundoscopic examination here is not looking like that of giant cell arthritis. We'll talk about that shortly. The next is posterior ischemic optic neuropathy. Now, ischemic optic neuropathy generally is responsible or is one of the most common causes of visual loss in patients above the age of 50. Yeah, so very likely to be PION. But the problem with this is that we actually have changes in the fundoscopic examination. PION occurs posteriorly at the back of the eye, and therefore you should not see these changes. The next is papillary edema, so I can't see any edema of the optic nerve. So, in summary, this patient most likely has anterior ischemic optic neuropathy. We call it AION. Now, AION is considered to be the most common optic nerve disorder in patients who are more than 50, and it can also affect the back of the optic nerve, that's retrobulbar optic nerve in isolation, in which case we call it posterior ischemic optic neuropathy, which is actually a diagnosis of exclusion. Now, patients often have a risk factor or several risk factors, which includes cardiovascular or cerebrovascular diseases such as diabetes and hypertension. And anterior ischemic optic neuropathy is a result of ischemic insult to the optic nerve head. So, clinically, it presents with acute unilateral, usually painless visual loss, although about 10% of patients may actually have pain that may be confused with optic neuritis. Fundoscopic examination usually shows optic disc edema, unless it's retrobulbar, there's hyperemia, whereas sphincter hemorrhages, you have crowded and complex discs. The painless visual loss is actually one key feature that differentiates AION from optic neuritis, which is often associated with painful eye movements. Optic neuritis usually presents in a much more younger age demographic, usually females. Now, in contrast to giant cell arthritis, the optic disc edema in AION is more hyperemic than pallid. So in giant cell arthritis, you don't have a hyperemic optic disc. So back to our question, we have now established that the answer is anterior ischemic optic neuropathy. So that's basically all for now. Thank you for your time. See you in the next episode.